when someone has been through trauma and they feel like they're losing their minds, there's something wrong with them, very often there will be changes in the way they're relating. And it's so evident that someone is distressed or traumatized. They may be more impatient. They're not attentive. That person who's experiencing trauma won't realize that they are traumatized or experiencing trauma. Hi, my name is Warwick Phipps, and in this episode of our podcast, Monique Schoeman and myself are talking about trauma. What it is, what does it look like, and how as therapists and individuals we can minimize the impact it holds over us. Share this with someone.
It's been a very rainy day today, and today we are having an opportunity just to talk about trauma. And there's a lot of questions that come up with some of the communities and people in which we work with. Some of these questions maybe can be helpful for society and people to get an understanding of trauma. So maybe we can delve a little bit deper into trauma today. Yes.
I just want to say that I'm excited about this. You are a very experienced psychologist, and you're with your own therapeutic skills. I know you've got a lot of experience in the treatment of trauma, and so to be able to talk about trauma together, and I think it's so meaningful because there's such a need to understand trauma. There's such suffering with it, and if one can just understand it and know it, there can be such relief. So I'm excited that we're doing this.
I share that. Yes, sure.
Yeah.
On that note, maybe we can just kick off with a fundamental question of what is trauma, what is trauma?
That's important, very important question, because it's both what someone experiences subjectively, and then it's what one can observe or what one can see. When someone experiences something directly where it's terrifying, and they're afraid, and something that threatens them, or someone that they love or care about, or just that they see someone else, another human being, that's a grave risk or threat, the experience is one of such horror and terror and fear, and one just becomes completely overwhelmed by that. And that's something of the experience, the subjective experience, how one feels with trauma. The other part of trauma is, how does it appear, and what will one see? And what you'll see there is someone goes very often into shock. They are not responding in their usual ways. Their judgment, the way they do things, they're just not their normal selves. And they can be confused, extremely anxious, or the way in which they usually are relating and behaving, that's changed. So how it looks is someone is just behaving and relating and responding in such a different way, and how they feel is often just completely overwhelmed in that moment. They just cannot cope with the horror or the trauma or the threat of what they've experienced or seen or witnessed. And that's by various degrees on a continuum of extreme threat, and on the one hand stress, and less so, but nevertheless very distressing or worrying on the other.
Sure. It can have a very significant impact on human behavior, human functioning, our being.
It's dramatic. It's just so overwhelming. And the thing about trauma is that, I think, as we know, that all of us, when we experience any kind of threat or horror, will go through something that's very similar, not identical but similar. And so it's just part of how we are when we as people, human beings, when we experience anything like that that's horrific or terrifying, it's just so overwhelming.
Yes.
Even when we understand it, and we can really know it well, work with it, or have experienced it, but in that moment when you experience it, it is just so terrifying or overwhelming or distressing. So
it not only affects your thinking, and I can hear the confusion that can occur for a person sort of mentally as well, the effects of trauma. This leads me then to the second question, which is then, how does trauma manifest in the body? How does it affect, or how can it affect the body? Yeah.
Sure, that's again, that's a very important question, because trauma, one part of trauma, as you say, is the thinking, the psychological, the emotional experience, and it can be extremely distressing. And the other part is that because how we think and feel, and we're body mind, we're connected, it has a huge impact on our physiology. One of the immediate reactions to stress is we go into a red alert state. And in that state, we can do remarkable things. It's known as the fight, flight, freeze response, and it's an adaptive response. And so we have strength. We can have clarity of mind. Things can slow down. We can run fast. There's just an enormous way of adapting there, and things that we can do. But the problem with that is that they are so demanding on our system, because when we go into that, it means there's adrenaline. Our heart is pumping faster. Blood pressure is increasing. Respiration. There's perspiration. There's this whole. It really is a fear response, adaptive, but it is so draining. Not only is the adrenaline, but there's cortisol. That cortisol helps in the beginning, because if there's been a puncture, an injury, then that cortisol is going to help limit injury or damage. But if that continues for some time, that starts to wear down the immune system. The other thing is all the muscles need glucose, so all of that is released into the bloodstream to provide the energy, and that needs to be utilized. So, and in that state, there's such major changes. A lot of the system moves away from anything non-vital, like digestion is not vital. So everything moves, the blood moves away, so the digestion system to the eyes, the brain needing more oxygen, needing more glucose. And so there's a huge shift there. Effectively, there are just these profound shifts through the body that we all go through. And if this goes on for some time, or we're unable to work through it, this can become damaging. So very often when we go into trauma, we go into this red alert state, terrible fear, enormous tension and stress. But once the danger is past, we often stay in that state, and we can be in that for a really long period of time. And then it can start to have a lot of impact. That's just on the first phase. And then there's this chronic phase, where we're just being triggered or conditioned and just going into this red alert, coming down, going back in, going down, until we just go up and we're just pretty much in a steady state. And then we're just constantly in this red alert state.
It sounds like there's a lot of overlap then between some symptoms of anxiety and chronic anxiety, with that sense of difficulties in the digestive process, and what you're linking there as well.
Yes.
To how literally the body responds differently to focus on survival and
Yeah.
what's necessary,
Yeah.
what's essential.
Very much.
Yeah. And that really we can get stuck in that red alert stage, that stage of just being in that heightened state constantly.
Yes. Yeah,
Sure.
so much so. In that way, if you just, our body has a nervous system where there are two responses. Either it's the go state, which is an arousal state, which is your red alert, fight, flight, freeze, an incredible state. But you've also then got a foot on the brake state, which is your rest and digest. That's a healing state.
Okay.
And we've just got only those two. So we're either in go state, adrenaline state, red alert, or we're in rest and digest, foot on the brake, rest and digest.
Okay.
And so a lot of the time, modern life, we once we start to become conditioned or triggered, we go into red alert. Before we come down, we go in, and we just stay there. The challenge then is that in modern life, we can't often distinguish between what's really a threat and what's not. So seeing a rhino in the bush is a real threat, and one will climb an acacia tree in seconds. And the danger's gone, you don't know how to get down. And that's a real threat. But in modern life, we just start this, and this is the overlap with anxiety. If we've got an urgent meeting, or we've got a report that needs to be done, or a call, our brains can't distinguish between what's really a real rhino, what's not, effectively. If that's a big enough threat, we know it's not a rhino, but the body can only produce one of two responses. Either we're going to go into red alert or not. So a lot of the time, we're just seeing something of rhinos around, where we keep going into this red alert state.
Sure.
And as we're going into that state, it's extremely demanding, and it is all anxiety-based. But to move into rest and digest, healing is something else altogether.
Sure. That really paints a picture very clearly of how we're just constantly maybe seeing any stressor as a potential threat, and our body automatically responds the same way to that deadline, to that exam, to that report, as it were to a rhino.
Right.
As it would to a rhino.
Yeah.
Sure.
Yeah.
That explains a lot. Okay. Coming then to really what we are doing and what you have a lot of experience in is how is trauma best treated? Yeah.
I think there have been many developments in trauma treatment. And really what I see here, and I like the kind of the way in which you approach it, because we could really look at this. You're a very experienced therapist. And I would say at the center, at Therapy Works, the way we approach it is really, most importantly, the first thing is you've got to allow and enable someone to be safe and to talk through what their experience is. And that requires a very, very meaningful or safe therapeutic relationship. And the more that someone can express that experience, that horror, the terror, the more they can get it out, the more relief there is. Because usually with trauma, the first thing you want to do is just push it away. And the more you try to just push down or push away that terrifying experience, the more it tends to pop up. So we know it just keeps coming up. So the way you resolve trauma is by working it through, expressing it, talking it through to the point of saturation. And then it no longer has an impact anymore. You'll know that you've had you know what happened, but the effect of it is not painful or distressing in the way that it was. So a big part of trauma is just, first of all, being able to work it through and express it. And that can be a huge relief. Another thing to understand about trauma is that we've got and you're very familiar with hypnosis, being a hypnotherapist or being experienced in hypnotherapy, that we've got conscious, subconscious, but one could also think about front part of the mind, back part. We have a natural mechanism to work through trauma. And so that is the subconscious mind, the back part, that's just working it through all the time. Hence we get nightmares, anything that reminds us of the event, flashbacks. All of this is happening naturally, and it's an inbuilt mechanism. And that's helping to process that trauma and work through it. But we can help the long in therapy by really actively, meaningfully expressing it and taking that process that, unless treated, could be months or years if it was really traumatic, and bring a lot of relief shortly. So working it through. And that's building on that normal mechanism of the mind. So that's one part. The second part is, as I said earlier, when you go into trauma, you go into this red alert, and often you stay in this very high tension state, stress, being in the go state, fight, flight, freeze. And so you can utilize relaxation. I know you're doing a lot of breathing and teaching breathing and progressive relaxation. And if you can do that, you can bring such relief, because then you start to move out of this red alert state, right out. And you're effectively helping to move from this red alert into rest and digest. So doing that can be really meaningful. Another very important part of trauma is, in my experience, it's helpful to understand that you've got to not just express it, but each time you can be activated, you need to be able to desensitize from it, because it can become almost phobic, where anything that reminds you of it, you avoid. And as you avoid, you experience relief, but then there's more anxiety. And so what's actually needed is to safely, in a way you feel very comfortable, actually desensitize. And the beautiful thing is, we know through something called reciprocal inhibition that you can't be anxious and relaxed at the same time. Right. So the moment you become relaxed, and you can start to desensitize from what you experience, which was deeply distressing. So there's various ways that you can desensitize, and it's going to bring a lot of relief. The other thing is that, remember, and you and I have chatted about it, so I just want to, for me, this is fundamental. Trauma is not what did happen, it's what could have happened. And so with trauma, in that moment, it's not what did actually happen. If one has been in a plane and there was some challenge and was one engine, and one just goes through absolute sheer terror. But when the plane lands, it was a safe landing, everything was fine, everyone gets out, but many are traumatized, terrified, because it's not what did happen, it's what could have happened. Yeah. And so in trauma, you're confronted with what could happen, and in that moment you have to face it. So it's terrifying. And the biggest thing, as I see it very often, is for a therapist to understand that what is that thing that terrified them the most, or was so distressing? And because we're all so different, it could be the sound, it could be how it felt, it could be what we saw. And in trauma, you've got to get to what that was and work through it and then there's such relief. So you've got to get to, so it's not what did happen, it's what could have happened. And that is the reality that you're helping someone to work through. So that's really important. And very often family, friends keep reassuring someone, but everything's okay, you've made it, you were okay, and they quickly want to validate you did well, And all of that is important and necessary because it's valid, it's real, but it doesn't, that tends to take away from, if it's too early, that yes, that did happen, but in that moment, this is what I was terrified was going to happen, and I had to face that. Yeah. And it's not only just fear. We people, we have dignity. It could be something like, I was so scared, I wet myself, and I've never ever had that experience, and I just felt so ashamed. And when it was all over, I didn't want anyone to see, or I wanted to reach out to a partner, but I was so fearful that I looked after myself, and then realized that I wasn't there for my partner, and I feel guilty. And that's left me terribly conflicted. So one's really got to get to, what was it that was most extremely distressing?
Okay.
Yeah.
Okay.
And then the other part of it is, when we go through trauma, the most important thing is to understand that we're going to get back to our old self. And so if one's with a trusted therapist, or if someone you really trust, and you learn or know that you're going to get back to your old self, you're not losing your mind, you're not crazy, you're not mad, because when we go through trauma, that's how we feel, because we're relating so differently. We don't know ourselves or often, and so when we understand that we're going to be okay, we're not losing our mind, we're not crazy, it's a normal response in an abnormal situation, and we're going to be okay, and we'll be back to old self sooner than we think. But for the time being, we're going to have anxiety fluctuating, we're going to have flashbacks, but it's normal. It's a normal response in an abnormal situation. We're going to be okay. That brings such relief, because it's true and it's valid. And once one is through that, a later step in therapy is going to be helping someone to work through the meaning, because when we go through trauma, we reflect on things differently.
Yeah.
It brings life into focus, like what really matters, what matters to me, how did I feel towards my partner. So it brings up sometimes meaning of life. And so a therapist, it's so important to help someone work through what they were thinking and feeling, what they're experiencing in their body, bring the relaxation, helping them into that rest and digest, taking them out of the trauma, and then working to desensitize so they're no longer reacting, understanding that everything's normal, what they're experiencing, and then helping them process where it's indicated, what does that mean for them? Because they're back to their old selves, and they are, but in a new way, like what does this mean? And helping them to process that. So there's a lot to it just needs active support in working through.
Yeah.
And someone who, and it's someone very often trained, and someone who'll create that safe therapeutic relationship. And for me, I just share with you, I know because of the work you do, as do other team members, I know you work in a deeply caring, person-centered, congruent way with a lot of awareness. And the moment one's in that kind of therapeutic relationship, you can process trauma very meaningfully and take something that was going to take a very long time and work it through and bring such relief.
Sure.
So that's a little bit about how I see it.
Yes, sure. Very rich, very in-depth response. Thank you for that. I think very clarifying as well, that there's different elements of the treatment phase, and it's so important to bring that person out of that acute state of red and accelerate.
Very much.
And then within that safety of the relationship, being able to work through it.
Yeah, maybe I could add something, because I just think it's so important, what you've noted, that you can help someone out of that state, that red alert state, quickly. And the earlier you do it, the better. So the more quickly someone reaches out for help and receives that support, the more quickly and the more relief they can get. If it's been going on for months to years, it's going to take a lot longer. But if one gets help for that quickly, you can bring such relief. And I really, you and I know that the way we work is working in a multidisciplinary way. Again, this is where other healthcare practitioners, we work together, because as someone who's learning relaxation is bringing that tension down and helping them out. If they were so traumatized, they could then benefit from a little bit of medication from a physician, general practitioner, just in the short term, to help them come out of that while they are being supported therapeutically. But the main thing is that working in a comprehensive way can bring such relief and assist someone quickly in coping and not staying distressed. So timing and awareness and working together as a team in healthcare can bring great relief.
Yeah. Really building that person's support group with their primary healthcare practitioner, their GP, their psychologist, psychiatrist, if it's indicated.
Yes, very much.
To bring that rapid relief for them.
Yeah. And what I would add is that it's mutual, because what's so important here is your physician, general practitioner, psychiatrist, they can assist in bringing very rapid relief and utilizing medication. And that's only part of it. There's so much more to be working through. Yes. A good psychiatrist who's really therapeutically trained could assist with therapeutic work or refer for therapeutic work, the GP, physician. But the key is to work together, because working through the different aspects of it means really complete relief.
Right.
So that someone doesn't have to have that effect all the time. They can work through it, and it's okay.
Right. So what I'm hearing is that it's important to focus on both the pharmacological as well as the psychological components of the treatment of trauma, and really going for a 360 approach as opposed to one thing to solve it all.
Yes, very much.
If possible. Okay. You also mentioned a few things that are just sitting with me, and that is the subconscious and hypnosis and trauma that has been perhaps unresolved for years. And what is the role of hypnotherapy in the treatment of psychological trauma, but specifically psychological trauma that has gone unresolved for many years?
There are just so many different ways to assist with hypnotherapy. One thing about hypnotherapy, as you know, is that it is really a profound state of relaxation. And with hypnosis and hypnotherapy, you can achieve such a profound level of relaxation that in itself can assist someone to come out of that red alert state, and the relief that comes with it, and just being relaxed, almost like a reset. So many will express it as something of a reset, because it's just so profound. So that deep relaxation. The other thing that we know is that when we're deeply relaxed, we feel safe, and we can engage and understand aspects of our experience. And the amazing thing is, every experience we have registers an impression, and we often think that we forget things. But what's fascinating in hypnosis is that we can remember and recall things profoundly, and often so accurately and so vividly that we can almost experience it as happening now, but in a safe relationship, a therapeutic relationship. So in hypnosis, we can understand ourselves. And very often, like I said earlier, trauma is not what did happen, it's what could have happened. And so in hypnosis, you can understand profoundly what was the thinking or the experience at the time. What was it? Because when you're through the trauma, that has sometimes been pushed away or you've forgotten, but you can understand your experience. And the other thing that's so important is that sometimes with trauma, it's again not what did happen, and it's what could have happened, or it's our perception. How did we understand something? And when you in a state of hypnosis, you can learn and understand things that you can't learn as quickly or as easily. And when you were someone trusted, an expert, someone who understands, you can, in a state of hypnosis, begin to experience something in a different way. The beautiful thing about hypnosis too is what you help to bring on by suggestion you can take away. So you can change any aspect of the experience. If there was something very distressing in the trauma where you felt very, very nauseous, in hypnosis you can just have some part of that experience but take away the nausea and just have the thinking in that moment. You can change any aspect of that experience, and you can work through a little piece or a little piece and a little piece, like pieces of a puzzle, and then have worked through it systematically, in a way that felt safe, wasn't overwhelming. And that's part of what you can do. You can also in hypnosis have parts of that experience when you're ready, just float up at a time when you're ready for it. Maybe there was a part of it you weren't ready for. And so in hypnosis, you can work something through, and then, provided it's okay and with suggestion, that can come into your awareness at just the right time and the right way, where it's not overwhelming. And so then move into consciousness and be able to, I've got it, I understand, got it, and it's no longer overwhelming. So hypnosis is a profound state, relaxation, learning, and how we can understand ourselves. And that's really what is possible in hypnosis, so much so. And you were talking about where trauma has been very well established. I think we would think of that as often being called complex trauma, where it was repeated trauma, or from a long time, very, very long time ago. We can't often remember how we felt or what the experience was. And so with complex trauma, you can understand it. But the beautiful thing is you can understand it as something of it happened now, but also being the person, an adult, with your awareness now. So you can, with your what you know now, in a sense, sometimes one wishes what you know now, you knew that then, but you couldn't when you were younger. And now, with what you now know and what you understand with your therapist in the hypnosis state, you can work that through, but with what you now know. And that's incredible, because if you experienced something where it was terrifying, where, for instance, you were in water and you were struggling and you were terrified, you were drowning, and you've been traumatized and you've been avoiding water ever since and become phobic. In hypnosis, you can understand something of it, but then learn, if it's accurate or valid, that one's parents were there, that they would have jumped in at any time. And the incredible thing is you can then, in hypnosis, just come to understand that, and if you wish, just process some of it, but with a full understanding, and suddenly that terrifying fear is gone. And now you can actually, in hypnosis, start thinking about how much you'd like to begin to experience and have new experiences around, be it some aspect of water, a bath or a shower or a pool. These are things that are so difficult to do in the usual state, but in the hypnotic state, where you're deeply relaxed, you're connecting with a very deep part of yourself in a trusted, safe way, you can accomplish remarkable things.
Sure. That's it really is a vehicle it's a vehicle that can help you access so much in a safe therapeutic relationship.
It is.
Yeah.
I also to share with you that hypnosis is so meaningful that when one sees the change that is possible, every time, well, certainly the experience for me is, wow, this is a change, and the depth of it, and how quickly it occurred, in a way that is profound. And then it makes doing the work because hypnotherapy requires experience, as you know, and you've got to be able to really work meaningfully, working with anything that's distressing, and so it's very, very meaningful. It's also it's demanding on a therapist, and so sometimes one is inclined to think one can just talk it through, but no. When there's something like complex trauma, wow, if you can assist someone with hypnotherapy, it can be life-changing.
That can be, emotionally and physiologically, because those two are so intertwined.
Yes. Yeah, very much.
Sure.
Yeah.
You had mentioned there as well that you can work on aspects of the process of that experience of trauma. And many might say, well, then if you can work on aspects or even remove an experience, could they not perhaps ask you to just remove that trauma completely, or that memory from them, because it was so traumatic?
Yes.
That they have a desperate need for that just to be taken away from them. Or that you could change the outcome in some way for them. And just what are your thoughts on that, and the role of keeping things as they are, but maybe also the role of suppression? And
your question has so much awareness, and it's so important, because when someone experiences trauma, they just want to push that terrifying, distressing thing away. But that pushing it away, which is, you could think of it as suppression or repression, the more one pushes it away and is out of awareness, the more energy it takes, and the more that affects us in ways we don't know. So yes, in hypnosis, I suppose someone, and as therapists, we're often asked to change that, distort that experience, because we have fantasies and wishes, and we don't want to have ever experienced that pain or distress, that shame, the guilt, the terror, and so often that's what one, if anyone's experienced trauma, just wants it not to be there or forget. But here, that's where we need to be so mindful, because as we want to help, and I know how caring and how your desire to help others, but we know this as psychotherapists that mechanism of distorting it actually is not helpful. In fact, that can compound the problem, because it's so important to work it through accurately with the reality of it, and not as a fantasy, but for what it is, and working it through thoroughly, but doing it carefully in a meaningful way. So yes, being very careful not to try and accentuate repression or suppression, which will just in effect compound the problem more. So it's to work it through very, very meaningfully.
Okay. Yeah. Then there's a proper release. There's a proper relief as well.
Yes.
With that is what I'm
Yes.
hearing. Yeah.
Yes.
Very thorough.
There really is. It's not only a mental, emotional, psychological relief and release, but there's a lot of research showing now that memories are, we've got a brain-body axis, and the way we store memories seems to be part of a body-mind system. So experiences, memories can be connected and stored seemingly in other parts of our bodies, in other organs, and so when we're talking about a release, we're not just talking about a mental, psycho-emotional. What that does is, because we're body-mind systems, what we're thinking translates into physical, and physical into thoughts and emotions. But as we get that relief and release, it's actually occurring physically. And not only are we going into that rest and digest, healing, but one can often anticipate there's such... those who work through trauma begin to say something has changed, digestion has changed, or there's a part, I've been struggling with a kind of pain, it's just, I don't know what's happened, it's no longer there. And so there are profound physiological changes and releases that also occur with the release and working through trauma.
Sure. As you're saying that, one's also just struck then by the physiological symptom or aspect of stuttering, and how that's also something that can be connected and is deeply connected to trauma.
Yes.
And as we've spoken before about that as well.
So much so, because the profound thing about any kind of stuttering is that it doesn't actually involve usually any difficulty or problem with actual speech and the ability for speech. So usually what it has to do with is an early distress or trauma, and a very often a complex one. And usually first order approaches involved aspects of breathing, which is very meaningful, then aspects of teaching someone to speak more slowly, and that has its place. Speech and language therapy can be so meaningful, and so helping one to work and being able to express and talk more effectively. But usually that in itself just assists someone, as important as it is and as valuable, to just cope with the stutter and be able to at least express themselves and talk. But it won't usually resolve it, because usually that is at a deep emotional level, a trauma. And so it often requires a very well-established therapeutic relationship that can be often a few years or even longer to begin working through and in a trusted way, working through, much like layers of an onion, moving and working through until one works with very deep trauma or distress.
Sure.
And hypnosis there can be profound in working that through.
Sure. So I think there's so much richness in what we're discussing that many people observing or just watching, listening, maybe thinking to themselves, sure, I think I know somebody that may be traumatized, and how can I get them to go for some help?
That's so important, to be able to see it and to recognize that someone's traumatized. And maybe I could just note two different parts there. When someone has been through trauma and they are traumatized, very often there will be changes in the way they're relating. They may be more impatient if they're generally patient, or becoming more irritable or withdrawn. They may tend to want to avoid going out to certain places. You may notice that their concentration they're not attentive. They seem preoccupied. And again, things like sleep disturbances. So very often it's so evident that someone is distressed or traumatized. But the key thing is very often that person who's experiencing trauma won't realize that they are traumatized or experiencing trauma. And because so often they feel like they're losing their minds, there's something wrong with them, they're crazy, they're going mad, they begin to wonder when they see these sort of different reactions, maybe there really is something wrong, maybe I am losing my mind. So the key thing in trying to help someone with trauma is to recognize that they're going to be okay. They're going to get back to their old selves. It's just a normal reaction to a normal situation, and they're going to be okay. But just bear in mind, and family, friends, someone you value at work, just again bear in mind that they may not recognize that they're in trauma, and maybe just thinking, why am I doing this? What's going on? And feel unable to talk about it, either because they don't want anyone to see it, and they see it either as confirmation that they're losing their minds, or they're crazy or something, or they have an idea that they need to be strong, or if they express it, it's weakness, and so they hold back a lot. And it's important to understand that's what's happening. The other part of it is that they don't want to remember or go to what it was, and they keep want to push it away. And so that's another reason why they may want to not reach out, because it brings it up, and it's very frightening. So just what's important there for anyone to help is to recognize what some of the signs of trauma are, so just spoke about earlier, and then to recognize that they're going to be okay. They're going to get back to their old self. It'll be sooner than they think. It's a normal reaction to an abnormal situation. They're probably going to need help. And just to recognize that first, that person needs to be validated for their experience, help them to talk about it, work it through. And from there, then begin showing them that this could be trauma, because very often they don't realize it. And showing them some of the signs, and quickly normalizing that it's a normal response to something abnormal. It's okay. They're going to be okay. Everyone who goes through trauma goes through this. And the main thing will be to get some support, get help, and they're going to be okay.
Sure.
That can go a long, long way to assisting them.
That can really mobilize both the person that's concerned, but also, the person who's experienced the trauma.
Yeah, very much.
Very much.
Yeah.
A lot of what we're talking about may also apply to children, but maybe I can just pose that question: is what does trauma look like in children?
I'm glad you asked me that, because I do think that children and adults respond so differently. Adults are so cognitive and trying to work through things in a very matter-of-fact, rational way. Children are so symbolic, spontaneous, and they deal with their world through play, expression. And so it may be quite different seeing a trauma in an adult and in a child. So with an adult, the trauma, they'll often express it in some way. With a child, you may not know at all. They may not talk about it. They might not even know what's bothering them. And some things to look out for are their sleeping a routine. Is there any disruption there? Are they reporting any nightmares? Are they becoming more clingy? Has there been a change in things that they've established, like their potty routine, and has there been any change there? Has there been any change in their school functioning, and change in marks, or any reports from the classroom? Or being out with friends, not wanting to be out, and wanting to not be with a close friend. With a child, any significant change in their behavior is something to look out for.
Right. And that can come from school, from home, from whichever context that, these key adults in that child's life can pick up on. And then
very much, because for a child, especially younger children, they live in a world where they rely on parents to help them judge things. So they don't often have a well-established critical faculty, so they can't judge things for themselves. And so an adult will quickly realize what's off or about a situation, but a child won't very often. And so there's an impact and the distress, but they don't know how to articulate it or express it. They don't know that something necessarily bad or wrong has happened. And so they don't know how to reach out for help. They don't know how to cry for help. So the cry for help is often just expressed in some way without them even being aware. And that's why it's so important to note any change in that routine. And it can be any aspect: school, friends, being with family, any change in their relating functioning.
Right. It's really got to take attentiveness and just seeing what's happening for this child, and then registering it and acting on it by either coming for play therapy or child psychotherapy.
Yes.
Just having that safe space as with an adult.
Yes.
For that child.
Yes.
Yeah. Okay. Many people may also be wondering, can an adult or child get traumatized by watching something or by hearing something?
Yes. I think that's one of the misperceptions and misunderstandings about trauma. Often we think that it has to happen to us, but it's not like that. If it's someone you love or care about, or just seeing something terrible, or even hearing about it, it can have such an impact that it's effectively secondary trauma. So by hearing about another's trauma or seeing it, there can be secondary trauma. So yes, and that is just as if then one went through it oneself, and one was and you go through trauma. It's also so important to recognize then, especially with adults when they've experienced trauma, that especially in a home with children, that it's very important that the adult work through the trauma out of the range. There should be a boundary from the child or children, because one's inclined to want to talk about it and talk on the phone or talk with a partner. And what actually can happen is the child then, through being exposed and hearing, now suddenly develops trauma. So it's so important to recognize that we can experience trauma just by seeing someone else, someone we care about, so them go through trauma. Ourselves as therapists, we can experience secondary trauma. And then in the home, to be very careful with children, because they're like sponges. They just absorb, and they can quickly experience secondary trauma, and to know and to look out for that.
I think that really opens up our awareness of just how one can get traumatized, and how there can also be a lot of room for miscommunication or misunderstanding about, but how are you affected by what I've been through? Or how's the child affected by something we've gone through? But actually that, children, like you say, are sponges, and we as human beings, through our care for another, can become deeply traumatized. What
I would also just add is that if one just with an adult, because adults will judge it so quickly, often that misunderstanding about that you can be traumatized, even if you weren't there directly, but just hearing, that an adult then won't realize I am traumatized or distressed, but begin to feel guilty. But I wasn't there. How could I be feeling this way? Surely I shouldn't reach out. Why can't I deal with this? And have all of this conflict because they don't realize that, yes, they can experience trauma and be traumatized on account of hearing or being exposed to someone else they care about. And they will need assistance and support as well.
Sure. Speaking of family systems, parents, children, and people who care about one another, what is generational trauma?
Generational trauma is often now referred to as intergenerational transmission trauma. And what it relates to is that the idea and the understanding that one generation can pass trauma on in some way. And so, for instance, a grandparent who was traumatized could in some way pass on their trauma to a child who's now a parent, and in turn their child a grandchild. And initially it was only thought that this was just through modeling and learning and modeling from one generation to the other. But what's now coming out is that it seems to be that because trauma is not just mental, psychological, it affects the body physiology, that what can happen is, and we saw this with, there have been many studies around the Holocaust survivors, that very often the next generation would respond with a higher level of post-traumatic stress disorder, extreme trauma or PTSD, and respond in ways with high levels of anxiety that couldn't be explained on simple modeling or just learning, that there would appear to be changes in physiology that could even be passed on genetically and have now been coded, because we realize now genes can be switched on and off depending on the environment and learning. And so, yes, it's possible, or certainly there's a hypothesis that the trauma can be encoded at a deeper level, at the level of a gene, at genes, and give expression in the next generation or the one after. So it really is something that can go from one generation to the other.
Right. That would make a lot of sense, given that our understanding of the biological factor with the biopsychosocial model, and understanding that anxiety, depression, and other related difficulties can be hereditary, or there's certainly evidence to suggest that there's a hereditary component there.
Yes.
So, and if we now know that trauma and anxiety and stress are very much interrelated, we can see how that can very much be generational as well. Yes. Sure.
Yeah, the understanding now that trauma and memory of that can be stored in different parts of the body. I mean, that was really not understood, and that we can possibly even be changing genes, that the environment can affect a trauma impact, can affect genes and the transmission. It shows how complex this is, and hence the need for really working through trauma and dealing with it very meaningfully.
Right. One of the things you mentioned in that very rich response as well was PTSD, and I think it's a term that's very much thrown around in pop culture as well, or just spoken of amongst many. What is PTSD really?
Well, PTSD stands for post-traumatic stress disorder. It's the stress post or after the trauma. So the stress or the anxiety post or after the trauma. And where it was initially understood is understanding war and veterans. When these soldiers would go into war, hard, resilient, extremely tough individuals, and would emerge from wars where their function had been compromised. They couldn't do things. They were anxious. If there was the sound of a lawnmower on a Sunday, they would drop to the ground. And so they began to understand, try and figure out what is this. And so it became clear that trauma is associated with a whole lot of symptoms, and that are predictable, not exact, but anyone who goes through trauma will very often begin to have nightmares or a sleep disturbance, difficulty falling, staying asleep, difficulties with concentration as one has flashbacks, vividly re-experiencing, which is the flashback, or just some disturbance in thought and not being able to concentrate, being irritable, wanting to avoid anything it reminds. So suddenly, the more you look at it, you see this constellation that everyone who experiences trauma, somewhat universally in one way or another, these start to come up. And so this was the understanding. Again, it's a normal response to an abnormal situation. You're going to be okay. And so actually the understanding of PTSD brought a lot of relief, because by the time someone is so distressed, they really do believe they've lost their mind. They're sometimes using substances, have become very secluded and are deeply distressed. And as soon as they begin to understand that it's normal and that it's PTSD, it's a trauma reaction, it brings such hope and relief.
So hope is I'm hearing it again, hope is a very big part of resolving trauma and PTSD as well. Yes.
I want to underscore that, because you asked me earlier what is necessary to resolve trauma and the treatment. And something that's very, very important is when working through trauma, it's most important not only to work through it, but if one actually needs to become re-empowered. And so you need to become re-empowered. You need to take back your strength. So empowerment is very important. And hope. Human beings, we're all about hope. And we need hope. It doesn't matter how difficult, challenging. We need hope. It needs to be realistic. But we keep moving forward as human beings. And the installation of hope and knowing it's real, valid, is absolutely key as a first step in beginning to seek help, or beginning to realize I really can work through this. It's going to be okay. I'm just going to need help and support. I'll be okay.
Sure. I hear you there, and it's always been, it's amazing if you look back on history and some of the atrocities that humankind has had to face, and the strength of the human spirit. There's always been an element of hope somewhere, or some fighting back, which shows hope, and such resilience. In human beings.
One thinks of Viktor Frankl, his incredible work around existential therapy and logotherapy in his book Man's Search for Meaning, and how in the Holocaust and in the concentration camps, that those undergoing terrible suffering, trauma, with many times no way out, but the only thing that they had was how they would respond, their dignity, hope, and how profound that is for the human condition, no matter what is going on.
Very profound what we're talking about here today. Very profound, very meaningful. Without what we have here, access to, psychotherapy, information at the touch of a finger, tip of our fingers with our technology, can trauma be resolved spontaneously? Can it go away without being treated?
Yes, and under certain conditions or certain contexts it can. If one understands trauma and you're able to talk, so the more you understand trauma, the more you know what's going to happen. So as a therapist, you can understand trauma, and if something happens, you understand that you, for instance, not your usual self, that you're going to be irritable, that you're not going to sleep, you're going to have nightmares. you're going to feel anxious, you're going to avoid. And the amazing thing is, as you understand that, that already brings relief. It's not going to take it away completely. But already you're not starting to wonder what's wrong, or am I losing it? So the moment you understand it, it gives you a different perspective with which to understand yourself and your reactions. That's already a relief. And when you're able to give expression to it, talking about it, being able to express it, some meaningful relationships, those willing to listen to you, hear you, the more you can express and get it out and go against what kind of feels natural to kind of, you want to avoid it, don't think about it. Talking about it, expressing it meaningfully. And so, yes, you can work it through at times, or it just is worked through. So it's possible. But time in itself isn't the indicator necessarily of working through or just resolving trauma, because something was deeply distressing. What has been found, it can be one can experience acute or chronic trauma, PTSD, 30 years later, if untreated. So time in itself isn't just a single indicator. It depends on how you understand it, your relationships, how you can work through it, express it, where you're empowered at the time, or if you remained very powerless. And so those are some things that will contribute. So it depends on the situation,
Right.
From person to person and their family system and their primary system.
Okay, yeah. So a lot of it is relational support, relationships, and also maybe that person's frame of reference in terms of the ability to express what they're sitting with, whether it be through either communicating to somebody that they trust and feel safe with and feeling understood in return, but also maybe expressing it through some form of creative expression, art or drama, or something that would give a voice to that trauma.
I think that can be so meaningful. What I often experience is that people sometimes delay. I think we all, very often, we want to try to prove to ourselves we're okay, we're managing. So we sit with something and we're distressed, where we don't need to be so distressed. Or just by reaching out, and we can have such relief. And very often, it's if you do all of these things, the expression, talking to others, and if it's severe, if the trauma is very significant, reaching out professionally, because it's not quite the same if a partner tells you. A partner can think maybe you're being biased, you're just telling me what I want to hear. It's so you really, with trauma, really need someone informed, someone who you trust, a therapist, where they can really guide you. And it's amazing if you just hear that, if someone just hears it and knows it, and they're hearing this from a therapist who specializes in trauma, suddenly they'll say, but you know what, my partner was telling me this, but I didn't quite get it, or I wasn't sure. So there's a place for comprehensive support, and the therapeutic support can bring such relief quickly, upon which one can then add and bring relief in other ways.
Sure. I really think that what we've discussed is such a fundamental, it gives a real foundation for trauma, and there's so much more that could be looked at, and we could probably sit and talk about it for hours more. There's such depth to it, and all the connections as well that we've touched on, the physiological side, looking at symptoms that manifest physically in the body, and also looking at hypnotherapy, and looking at children and their development and how that relates to trauma.
Mm.
So there's a lot more that perhaps we'll come back to in future episodes of the podcast and the series. So maybe what I can just say is it's been a pleasure for us to really look at this today and discuss it so meaningfully and just share awareness about trauma and actually create awareness and give a little bit of shine a light into our world of therapy and therapeutic interventions. So thank you for shedding all that knowledge and light for us.
I appreciate that. For me, I really enjoy talking to you, and as I just the way you think about it and the questions you ask and how we've been discussing it, it is in a way just like the tip of the iceberg. But it's important. It's showing, it's creating awareness, because with that awareness, the more anyone knows, it doesn't need to be that degree of suffering or the relief. So I think trauma is just of the most, I think it's profoundly important and the kind of support and relief available. So I've enjoyed with you talking this through.
Thank you so much, Warwick. This was really meaningful. It was wonderful. Much appreciated. Yeah.
Very much shared.